Everyone.
Good afternoon.
Imagine for a moment that you, your child, or a relative was born with a rare disease that you knew nothing about. You feel helpless. You need information, but where do you go to, or who do you turn to? The title of this speech is called The Fear of the Unknown. You could turn to a doctor. You could turn to a friend that might have this rare disease. But one thing that they will have in common is this rare disease. Society, and that's including doctors, are the most uneducated people when it comes to TAR syndrome because they are not genuinely interested in knowing about it, or they don't want to know about it because it does exist. As a person born with TAR syndrome, the only place I had to turn to was the Shriners. According to the National Organization of Rare Diseases, the clinical name for this rare disease is thrombocytopenia absent of the radius. Today I will inform you about TAR syndrome. I will explain in my speech what TAR syndrome is and the undesirable effects that it has on the individual and their human body. Thrombocytopenia, TAR, is a rare disease that is characterized by the low levels in the blood at birth that results in the absence of the radius bone in the forearm. TAR syndrome was first identified in 1951, but was not given a name until 1963. According to the United National Library of Medicine, TAR syndrome is a genetic disorder that is inherited from the mother. The cause of this disorder is the recessive autosomal gene that causes different mutations in the RBM8 gene. The result of this infected individual gets one normal gene from the father and two abnormal genes from the mother. TAR syndrome is so rare that the estimated rate is 1 in 200,000 to 1 in 100,000 individuals that have this disorder. The undesirable effects of the human body of this individual is malformations of the body. People have malformations of their heart, kidney, lungs, legs, and arms. Being a person that was born with TAR syndrome, it didn't just affect my arms, it affected the rest of my body. I was born without a uterus. As a woman, I do not have a menstrual cycle because I have a syndrome within TAR syndrome that is the cause of all the malformations inside my body. The place where I went to get my surgeries, the Shriners, they're the only people that I know besides Johns Hopkins and St. Jude's Hospital that may know about TAR syndrome. I would estimate about 40% of doctors in the United States knows about this rare disorder. So that means 60% of doctors don't know. In my conclusion, TAR syndrome has been around for ages, but is still a mystery in our society. Thank you.